Well, good afternoon, everyone. Let's start this evening's briefing with the Health and Social Care Minister bringing us today's numbers. I know the Minister also wants to update you on some testing related news. David.
Thank you, Chief Minister. Just before I do today's numbers, yesterday at the press conference I spoke about how we were expanding our testing to key workers who would be able to get a weekly test. I'm delighted to be able to say that after assessing our capacity to the list of key workers, we're going to be able to add teachers. So teachers will be able to join in with that and have the weekly COVID-19 PCR test should they so desire. Turning to the numbers today, the total number of tests undertaken now stands at 4,732. The total test results returned is 4,703, which means we have 29 results outstanding. The total number of positive cases identified remains at 336, with no further new cases. And in terms of active cases, we now stand at 3. I'm also delighted to be able to say that we have hit another milestone in the fact that we have no COVID positive cases in the hospital as of today. Thank you, Chief Minister.
Well, thank you very much, Dave. That really is excellent news, isn't it? In our Stay Safe Roadmap document that was endorsed by Tynwald on the 5th of May, we described how we would approach decision making through this pandemic. We of course want to do what is best for the island, balancing some really tricky issues. We had to balance COVID challenges that we understood so little about with the needs of our people, our society and our economy. And I have said so often, I think that as an island community, we have done incredibly well. We went in hard at the start and hammered those curves. We are doing some work to publish a new range of reports and charts. I know for some it has been reassuring to see that green line that bobbles along the bottom. You made that happen. We are now in a place where we are gradually changing those measures we had to use at the start. Every meeting of the Council of Ministers now is considering how much further we can go to give you your lives back. How much further we can go in the journey towards our new Manx normal. I know that for some of you that you have found it frustrating. You want us to move faster. I get that. Some of you are still worried about the virus and are not yet ready to make big changes. I get that too. But I have to tell you, I'm delighted that our toughest challenge at the moment is about how we can best step out of your lives. When this virus first came to our island, I had prepared myself for an altogether more bloody battle. As I told Tynwald this week, I will never forget the lives that have been lost on our island. We have mourned too much. But after some dark days, I do think I can start to see the light at the end of the tunnel. It is still some way off, but it is there. I have talked here about game changers. The ultimate game changer would of course be a vaccine. But despite a global campaign, this still seems a long way off, and we cannot bank on that coming in any time soon. Another game changer could be the antibody testing. Unlike the vaccine, this is with us now. And because of some excellent work by the Department of Health and Social Care, we are close to being able to start our on-island testing programme. The Council of Ministers today endorsed a testing strategy put to us by the Department of Health and Social Care. And I know that the Minister will make detailed announcements about this as soon as possible. But as I said in Tynwald this week, it will not allow us to see everything and know everything. Yes, it will allow us to know if a person has had the virus, but there is no global agreement as to whether someone who has recovered from the virus is immune forever, for a while, or at all. But the antibody testing will change our understanding of the virus on the island. Back to the Stay Safe roadmap. What we have tried to do is make changes in fortnightly cycles. This is so that we can see any effects and assess if it is safe to move on to the next steps. Do you remember all the way back to the 24th of April? It seems like an eternity ago. On that day, we started our Stay Safe plan with its Phase 1. We brought back construction, trades and horticulture. We also allowed some sports to resume. There was no impact on the number of confirmed cases that we could link to these changes. 2 weeks later, on the 7th of May, we moved into Phase 2. We laid out the pathway for our retail sector, our services and our non-essential healthcare to start to return. Some of this took a while to come fully online, retail on the 18th of May, for example. And some businesses have decided they are not yet ready, but I am pleased how this is going so far. And most importantly, again, there was no impact on the number of cases that we could link to these changes. Then another 2 weeks later, on the 21st of May, we started Phase 3. This included giving the green light to a number of sectors from the 1st of June, including outdoor dining, the beauty and hair sector, self-catering accommodation, and more besides. In parallel, of course, we have been able to make announcements about our schools reopening, and I know that schools are now at an advanced stage of preparation to welcome our children back in a phased and safe way. There are two things from today's Council of Ministers that I wanted to share with you. There are a couple of changes that we've decided today. Now, given the huge changes we announced last week, the changes we agreed today are more modest but important. Firstly, we have agreed in principle that we should explore ways to allow our returning residents to do so through air routes if they need to or it is safer to do so. We will also consider allowing them to isolate in a shared house, provided everyone else in that house is also prepared to go into self-isolation. We have asked for this detail to be finalised so that we can communicate how this will work next week, and we expect these changes to be live no later than the 11th of June. Secondly, given the ongoing positive situation of our intensive care capacity, we have decided that with effect from the 15th of June, we will be increasing the island-wide speed limit to 60 miles per hour. Now, I'm fully aware that this is a subject that elicits strong emotions on the island, and I have been clear the limit we had in place was to mitigate the risk of our intensive care being put under pressure when it might have been needed to focus on COVID. I also need to be clear that I do not want to put in place long-term legislation by the back door. This is an important matter that merits a full TIML debate and the ability for the public to be able to offer their views. We will review no later than the end of June in any case. As well as these decisions, we have now been able to start considering Phase 4 and beyond. We wanted to give our teams, and importantly give you, an idea of what we hope to be making decisions on when we come to the next 2-week review point, next Thursday on the 4th of June. These would be changes that we would hope to bring in no later than the 15th of June. I can tell you that there is a high level of optimism at the Council of Ministers. When we look at all our key indicators, live cases, hospital capacity, PPE stocks, etc., we have every reason to be optimistic. Ministers agreed that we should accelerate our approach of removing restrictions as much as we possibly can to step out of your lives. This will include thinking about if we can make changes to social distancing. There are a range of other ways of doing it in other countries. The World Health Organization's guidance is maintain at least 1 metre. And personally, I am attracted to the very pragmatic approach taken by New Zealand. On one hand, they advise 2 metres when you are out and about. This is because you may be in the midst of people you don't know and where contact tracing, if needed, would be tough. But they only talk about 1 metre distance when you are in an environment like your home, a school, a restaurant or a church where contact tracing would be much easier. With risk at a pretty low level now, we want to consider where we can go on this, and I hope to make some announcements early next week. We have asked for proposals to change the rules that limit gatherings. the 10 outside, 2 inside rule, to be ready for our meeting next Thursday. Ideally, I would like to gradually remove restrictions, including for large gatherings. We hope to make decisions on this next Thursday. Let's see if our current great results continue. Today we have commissioned detailed proposals on the areas where we still have restrictions in place. Next Thursday we will look to make decisions on the resumption of hotels and other similar accommodation, gyms and indoor sporting venues. If the situation on the island remains as positive as it is today, we would hope to be able to allow those sectors to resume no later than the 15th of June. In the meantime, we will step up our work with those sectors so that they have a clear understanding of what it will take to open safely. So what would be left after that? Well, not much. We have already started conversations with the pub, bar and nightclub sector. Some of them are already operating, including as takeaways, and some will be able to start operating from next week if they are able to offer outside dining. Today we discussed when we might be able to envisage pubs, bars, etc. to be able to operate more normally. Again, if we remain on top of the virus, we might be able to do so around the end of June or early July. This would then only leave the tricky issue of the border. There has been a certain amount of loose reporting about this over the last week or so, and I think it might be useful to put the record straight on this again. The Council of Ministers discussed borders today. We are in agreement that while at some stage we do of course want and need the borders to open, we are certainly not there yet, and we won't be for some time to come. But when we do come to look at the border, it doesn't need to be binary. It doesn't have to be as simple as open or closed. I still believe that unhindered travel between the United Kingdom and our island is a long way off. But as the situation slowly improves in the United Kingdom, we have been able to do more for our returning residents and for new residents, those who are coming to live and work here. And we want to do more for truly compassionate cases in both directions. We may be able to go even further if and when we start to see significant and sustained change in the United Kingdom. Until there is, we need to exercise extreme caution. The last thing we would want to do is jeopardise the hard work that has got us to where we are today. A final point from me is around the emergency regulations. I've said on a number of occasions that these were a necessary evil. These were not powers that I or my ministerial colleagues wanted to have, but I still believe that we needed them to move quickly and decisively in the best interests of the island. As I've said in Tynwald, work is now at an advanced stage on a plan to take us out of emergency powers, and I will lay out my thinking in Tynwald on Tuesday. I will now take questions, and first I believe is Amanda from Jeff the Mongoose. Amanda.
Good afternoon, Chief Minister. In light of your dismissal of Chris Thomas, some of the public are questioning whether collective responsibility is outdated and makes voting pointless, especially in these extraordinary times. Does this process need to be reviewed? Are you considering a reshuffle? And how long do you anticipate it will take you to choose another Minister for Policy and Reform?
Thank you. Well, I think the collective responsibility for the Council of Ministers has worked exceptionally well, Amanda. It's been 40 plus years now that it's been going on. Effectively, we have 9 ministers who all have different views. They're all independent. And we agree as those 9 that we will follow collective responsibility. So in any boardroom meeting, in any village institution, you will have a group of people who will sit and meet. A decision will be made, it will be voted on, and the majority decision wins. And that's what goes forward to take policy forward. And that's fairly straightforward and logical. Now, there are exceptions to having to vote with the Council of Ministers, and those are made on moral issues. So, for example, the divorce bill that's going through at the moment, the legislation in the House of Keys, all ministers have a free vote on that because it's not a Council of Ministers issue. It's for you to make a decision on how you believe from a moral point of view what should be done. The same with parliamentary issues. And also, if a minister has a pre-declared interest, and that's in his manifesto or their manifesto, and they can show that they've got this pre-declared interest, they get permission from the Chief Minister, then they can vote against the Council of Ministers in Tynwald. So we try and be as reasonable as possible, but you have to have that basic rule that if you have not got an agreed pre-declared interest, then you vote with the majority decision. Now, 90% of the time, Council of Ministers decisions are unanimous, but occasionally we'll have a 7-2 or occasionally a 5-4. But members stick to that because that's how you have collective responsibility. That's how you get decisions made and get on with things. And sadly, Minister Thomas disagreed. He was in a small minority, and he said he was going to vote against. He was advised in writing that he didn't have permission because he didn't have a pre-declared interest. He decided to carry on and vote against his colleagues, which is an automatic dismissal. So effectively, he resigned. I just went through the motions yesterday of sacking him because by voting against and breaking the ministerial code, I had no option but to dismiss him. So it's sad. Chris was a hard-working member of the team, but it was a decision he made. He had walked out on an earlier sitting on the border closure, which was disappointing, not to support his colleagues. And I felt that if you have a rule, it's there for everyone. It was clearly broken. There was no mistake made. He was advised in writing by email and before the sitting that he didn't have permission. And sadly, we are where we are. So I regret it. I'm sad about it, but it's still a very good way of operating a government, which is throughout the world, this sort of decision, and throughout the island on all sorts of community groups.
And are you considering a reshuffle, and how long do you anticipate it to take you to choose another Minister for Policy and Reform?
Well, obviously, this only happened on Tuesday. Tuesday, I will be bringing someone up to replace the minister, whether that's a reshuffle or whether I'll be putting a new member straight into the job. I'll need to sleep on that for a couple of days, but obviously I will put a press release out, Amanda, once I've made that decision.
Thank you very much.
Thank you very much. Now, Mr. Paul Moulton from MTTV. Paul, good afternoon.
Hello, Chief Minister. A little gurgly by link. Did you just say it was 60 miles an hour you're putting this speed limit up to?
Yes, where there's no speed limit, Paul. So at the moment you've got 20, you've got 30s, 40s, yes. 50s, but where there's no speed limit, so for example on the mountain you can go up to 60 miles per hour. Oh, that's on the 15th of June. It's not from today, it's from the 15th. What we try and do is, as we've learned, instead of making sudden announcements that happen straight away, we're trying an awful lot of the information. It is for information on the 15th of June. We're trying to give businesses our thinking. So the social distancing rules, etc., we're trying to help businesses plan. So instead of just getting a couple of days' notice that they can open, and these are the rules, today we're trying to share our thoughts with you all about where we see this going and what we're discussing at the moment, so that as long as the data still supports us making those decisions, it shouldn't be a surprise to those businesses in a couple of weeks' time to be able to open with the set of rules in place.
All right, because really my question is the thinking behind that. I mean, there's very few 60-mile-an-hour areas anyway. So you've got your 50s and you've got your de-restricted. So why this halfway house? Because it can't now be under the road safety is your sort of main reasoning, is it? I mean, is this still, and part two of this is I still get whispers, pretty good, some of my contacts that, you know, is still looking at a back way of making some sort of speed limit, excluding the mountain road, which could be like 60 or something in the future. I know you've been on here saying before it's not going to happen, but I'd like to hear you just give me a bit more.
Well, I've said, how many times can I say it, Paul? I've said just now that I will not allow emergency legislation to be used to bring in strategic changes to the island way of life, effectively via the back door. I'm not saying speed limits won't happen in the future, but that will be for Tynwald to decide based on feedback from the Manx public with separate legislation. We bring in the coronavirus emergency legislation based under the 1936 Emergency Powers Act. That is to fight help us fight our battle against coronavirus. And I think it would be wrong if the Council of Ministers used that legislation to make long-term strategic changes to the way that the people of the Isle of Man live their lives. Now, I have to say that I am starting to be inundated by people, and the vast majority of people feel that they like the 40 miles an hour speed limit. And that may well be the case, but we cannot use emergency legislation to do that, and therefore I've said time and time again, we will remove it eventually, and then it will be up to Tynwald and the Manx public with consultation to decide if they want to have this type of restriction brought in at some stage in the future.
Fine, and that's exactly what I was trying to get to. I wasn't suggesting under the emergency powers, but you are now actively potentially thinking there could be a change. And a supplementary to that, would the Council of Ministers have a free rein to vote as they wish, or would that be yet again an example of Council of Ministers doing a block vote on whatever the decision might be in front of Tynwald?
Well, we'll decide nearer the time. It'll depend on what the recommendations are, what the public have to say. But don't put my words into my mouth, Paul. I'm not saying it will happen. I'm just saying that if it were to happen, it would be by Tynwald having a full debate with the public having a consultation. It is not for the Council of Ministers, in my opinion, and the Council of Ministers agree with me, to use emergency legislation. So if politicians are lobbied by the public and then we go out for consultation and the feedback comes in support that the public want us to make changes, then of course Tynwald, not myself, Tynwald will decide the way forward. So what I'm just trying to lay down is that we will not allow emergency legislation to continue to bring in policy via the back door. I think that would be totally unfair. We use these powers to fight coronavirus, not to suddenly spring changes on lives of people via a secret route. It's there in black and white to protect the people from the virus. Okay?
Totally clear. Part two now, my second question is, you're talking about we get to the stage where pubs, bars, whatever might be opening. I don't know if you mentioned gyms in there because they're still very key, of course. But that would automatically bring the social distancing down to maybe a metre by the very nature of going into bars or whatever. Can you save Tynwald Day if that would be the case as well, being that you're talking about making this change in sometime in June, I think, was it, or maybe in July?
Well, I said for bars maybe at the end of June, early July. So I'm not giving exact dates. I said hopefully by the 15th for some of these areas we're looking at when our children go back to school. Trying to get a child to stick to 2 metre distancing is going to be pretty impossible. And given that fact that they're in a school where tracing, we know who's there. So I gave New Zealand as an example. They do a metre in schools, churches, and gatherings in family homes, because you know if you suddenly get ill, who's been there, you've got proper tracing. Whereas if you're out and about walking in the street, etc., you could bump into someone and you don't know who they are, and then if you caught something, you wouldn't be able to do the tracing of that person. So we've looked at how New Zealand have done it. I've looked at how several other countries have done their distancing, and the WHO recommend a minimum of 1 metre up to 2 metres. We went down the 2 metre route. That was right at the time. I think we now need to say, well, what is the way forward going forward? We're trying to make people's lives as easy as possible to live the new normal with the coronavirus. So this is something that we're looking at, Paul.
And sorry, just gyms, just as a throwaway there, were they on your list yet, gyms?
Yes, they were on my list. Yeah.
They're still,
and indoor. No, gym. We mentioned that gyms and indoor sports areas we were looking at with a possibility in 2-3 weeks' time.
Thank you.
Right. Next we have Jess Ward from Isle of Man newspapers. Jess, good afternoon. Nice to see you again.
Yes, you too. Could I speak to the Health Minister, please?
Yeah, no problem at all. David.
Good afternoon, Jess.
Good afternoon. So you've given us the great news that we've now had 0 cases in over a week, but also we've no longer got any positive COVID positive patients in hospital. I'm wondering, how is the government planning on letting redeployed medical staff who work in the COVID wards back to their original posts?
So, as I announced last Friday, our Back to Health plan allows for services to start being turned back on. While it's very positive news, I'm going to do my usual thing and say let's not be complacent about things. It's a great position to be in, but what we've got to do is now, in a gradual process, start redeploying staff back so we can turn on existing services that were turned off. And we've started that process this week. But we do still need to keep a COVID contingency, as I would say. So we still have to have a COVID response there in case there is any further admissions in the future. So that process has already started, and if people go online, they will see the Back to Health document. We are also working up a similar document for basically the social care side of it, and the Back to Care document I should be able to announce next week.
Thank you. I've got another question for you too. So as we all know, COVID-19 has changed our daily lives and work environments quite a lot. I'm just looking at the future of nursing homes and how has the virus impacted the government's plans for those institutions and to ensure the safety of its users?
Well, the nursing homes have worked very, very well with us in terms of infection prevention. The nursing homes have always been very strict around infection control anyway, because of the type of environment that they're in. So obviously, if they get outbreaks of things like winter influenza in a nursing home, that can be quite serious as well. So a lot of those structures were already there. And I think the key thing is being communication. We've worked together with nursing homes to get access to the PPE. We've given them guidance along the way, and that will continue. And it was in place for the things like winter influenza beforehand. That process will continue as normal.
Are we going to see any drastic changes, maybe in architectural structures or any planning processes, do you think?
No, in terms of nursing homes, obviously one of the things they've struggled with, particularly, is those residents that are mobile, and sometimes the dining rooms in the nursing homes haven't allowed for social distancing, so they've had to do staged dining. But that's something that will be around for as long as there's a risk from COVID. But in terms of nursing homes and the way they operate, like I say, they're very, very much focused on infection control and prevention. So that will not radically change from what was there already.
Okay, thank you very much.
Thanks very much, Jess. Nice to hear you again. Next, we have Alex Bell from the BBC. Alex.
Thank you, Chief Minister.
Afternoon.
Just to touch on a point you made before, to outline those plans to bring returning residents home by air. Is this viable? How many residents are currently left to return to the Isle of Man?
Well, we have a number of residents overseas, Alex. Some of them have been trapped in the jurisdictions in India, for example, where they haven't been physically allowed to go to an airport to get back. So it may well be that they fly in to London, and at the moment they've got to go through the country to get to Heysham. And if now that we know our stats, we know that the hospital has no one in there with the COVID illness, we can come up with procedures that are safe for the people of the Isle of Man, then we feel that we can allow those people to come off a plane, say at Heathrow, do a change and fly from Heathrow to the island, and that would be a safer way than potentially having to currently go through the rest of the United Kingdom. But obviously we wanted to make sure that we could put procedures in place to make sure that when they come to the island, there are checks to make sure they know they have to go straight home, self-isolate, all the rules and regulations, and that they can be monitored and their health checked via phone calls, etc. So you need to make sure you can put in a sensible set of precautions to A, protect them, and B, to protect the people already on the Isle of Man. So I've said all along as we go along, it's all about, we went in hard to flatten the curve, we did that, and now we're slowly, where we've got the evidence to that enables us to do that, loosening restrictions to make it easier for people to come to the island, but still making sure that there is the protection there for the people of the Isle of Man to ensure that we don't get a second wave by people unintentionally bringing the illness back onto the island.
The reason I ask is because it was last week that EasyJet announced they were going to restart or potentially restart routes between Liverpool and the Isle of Man and London Gatwick and the Isle of Man. Has this anything to do with that?
No, it's just timing. I mean, everyone mentions EasyJet, but Loganair have been operating flights between the Isle of Man for quite some time now. Hardly anyone on them because of the restrictions, but they have been operating those flights. EasyJet they didn't make it just for the Isle of Man, they made it for all of the United Kingdom. And we are at a position now where, as the health minister has just given you incredibly good figures on the number of active cases on the Isle of Man, 3, that we have the contact tracing team in place and all the other areas where we're seeing the 111 numbers right down, that we can now say to our teams, let's work up a repatriation scheme that now allows flights to come in to the island for the repatriation. So we're not talking about hundreds of people all flying back in the next few days. We're talking about allowing people who have maybe flown into London, the safest way to get them back is the Isle of Man, and we now have the capacity to allow that to happen in the very near future.
Okay. And just to touch on another point, please. From Monday, I know restaurants and cafes with outdoor seating can open again. When this was announced, I think it was suggested that businesses who met these requirements or maybe just slightly fell below them might be given some help to adapt to meet them. Has any of this help been given out, and how many businesses have claimed support in this way?
I'd have to get that information for you, Alex. That's the Department for Enterprise would deal with the advice to businesses. But obviously we're working with them. We've tried to be as helpful as possible by discussing the 2-metre thoughts that it might go from 2 meters to 1 for our schools, maybe for when you're in a restaurant for work, because you can do the tracing of those peoples from your businesses. But these are decisions that haven't been made yet. They haven't been agreed. This is just what we're currently working on, and we've announced it maybe earlier than we have in the past, sort of changes to give businesses as much sort of forward planning time as possible, so they are as well prepared as possible.
Thank you.
Thank you very much, Alex. And last but not least, we have Leanne from 3FM. Good afternoon, Leanne.
Thank you, Chief. Thank you, Chief Minister. My first question is just about car sharing. We've had a few queries as to people looking for a bit more clarity as to why it isn't permitted, just as they're able to ride on the bus or take a taxi journey or even go inside someone's home.
Yeah, it's a good point, and funny enough, I was down in Ramsey at the weekend, and a young lady stopped me and asked me that very same question, and it's something that the Council of Ministers are looking at. Obviously, if you're sitting in the front seat of a car with the person next to you, you're only a matter of inches. If you're a foot away from that person, then you're going to struggle. Now, there is an argument that you know who that person is, so from a contact tracing point of view, it might be possible. I went into my parents' house at the weekend, but I still kept my distance. I kept more distance than I would if I'd got in a car with them. So this is something that we are looking at, Leanne, and we will be giving an update within the week on car sharing.
Okay, thank you. And my second question is for the Health Minister, please.
Okay, David, thank you.
Good afternoon, Leanne.
Good afternoon, Minister. Like Jess already touched upon, obviously you've mentioned there are now only 3 active cases and no COVID positive cases in the hospital, which is obviously great news. My question is just, everyone that attends Nobles Hospital, are they still being tested for COVID-19?
Yes, anyone who attends and is admitted to hospital is tested, and that will continue to take place.
Okay, thank you.
Now, I think if memory serves me correct, Minister Skelly is with you tomorrow. So, Alex, I think it was your question on support for or advice for businesses that are trying to get back. I'm sure he'll be able to give you the latest update on those figures. So, thank you very much. Right, I think we've had a good hit here now. Thank you all very much, but we are getting there. Let's put our best foot forward. Please keep safe and keep your loved ones safe. Remember the basics, keep your distance, respect other people's space, and the future is in your hands. Thank you all very, very much. Bye-bye.